Okay, we are live. Hello, everyone. It's Kirsten here. Welcome to another episode of Weekly Hope. Please forgive the delayed start today. We had a little bit of technical difficulties, but we are all here now. It's great to see you and to have you with us. As many of you can see, if you join us every week for this Facebook Live interview series that we do, I usually have an unofficial co-host with me. She's been missing for the last couple of weeks, but you can see her little fluffy head and she is back. So I'm Kirsten and this is Elsa. Elsa is my toy poodle and her tongue always hangs out the side because she has no more teeth to hold it in. She's an old lady, but she wishes you all a very, very happy hello and a joyful week wherever you may be joining us from all over the world. But Elsa's going to be with us today. She's back from a little break and a little holiday, a little doggy holiday. But very, very glad that you're here. So before I introduce our guest, who's right there on the other side of the screen with me, I'll tell maybe those of you who are signing in for the first time, or this is just popping up into your feed, a little bit about who we are and what we do. So Weekly Hope is a Facebook Live interview series where we invite guests from the mental health field to come on and discuss a variety of different topics. Every week it's something a little bit different. And the goal is to have a conversation with these experts about a topic in the field, get their insight, wisdom, and expertise, and invite you to be a part of the conversation. Of course, that's the great thing about Facebook is that we have this comment section, so you can pop in, say hello, let us know where you're signing in from, tell us your name, and throughout the conversation, we invite you to ask your questions, to share your thoughts, to share your story, to tag someone who might be interested in this video. In whatever way that you feel comfortable participating. This is a totally safe space. And the clinicians that we have on this show are not only brilliant and wise and awesome to listen to, and it's always very, very educational for myself included, but they're also here to help you. So use this as a resource. Don't be afraid to ask your questions. I'll be watching the comment section as the interview goes by. So at any time something pops into your mind, please feel free to share your thoughts and to ask your questions because we're here to listen and to help. So that's a little bit about what we do. Today we're going to be discussing the intersection of two very commonly co-occurring issues in the field of behavioral health, and that's PTSD, post-traumatic stress disorder, and eating disorder recovery. And I'm very, very honored to have our guest here today. She is the expert and has a really, really incredible background. We are very, very lucky to welcome Irene Jacobs here with us today. So welcome, Irene.
Thank you. And thank you, Kirsten, for having me on the live. And I really appreciate it.
Yeah, absolutely. Well, we're so thrilled to have you and to have your wisdom here. Before we dive in and start talking about our topic, I do want to read a little bit of your bio so people get a little bit of your background. So Irene is the clinical director for Willow House at the Meadows Behavioral Health in Arizona. She has years of experience in counseling and administration, which has deepened her understanding of and passion for people who struggle with trauma and addiction. Irene has expertise in the areas of sex addiction, love addiction, relationship and intimacy issues, victims of domestic sex trafficking, human trafficking, survivors of torture, self-harm, personality disorders, addictions, and disordered eating. She has worked as a primary, family, and trauma therapist at the Meadows, which has given her rich experience in how to treat women and their families struggling with intimacy and relationship issues. On several occasions, Irene has been asked to contribute to the Dr. Phil Show as an expert on topics related to female intimacy and relationships. In addition, Irene is a contributing author to the book Voices. Extensive knowledge and experience combined with her clinical sensitivity and warmth offer healing and hope for patients and their families. So that's a little bit about Irene's background. So Irene, you've done the Dr. Phil Show a couple times. I hope this is this measures up.
Absolutely.
Yeah. No, it's really, really cool to hear your background. And it's one of the reasons why we're so excited to talk to you about these issues, which so commonly occur together. So first of all, before we talk about kind of the intersection of PTSD and eating disorders, I'd love for you to share exactly what post-traumatic stress disorder, PTSD, is. Because I think a lot of people, especially if a family member or a loved one is watching this, and they hear PTSD, they think of war trauma or soldiers coming back from a conflict. What exactly is PTSD?
So PTSD really incorporates two pieces. And the one factor that you mentioned is what we consider more of that overt, obvious type of trauma, like military veterans, people who have experienced something devastating, like a natural disaster, for example, or a horrific car accident. And there's also PTSD that sometimes we don't consider. It's not as obvious, it's more covert. And that piece of trauma can really impact us like the overt trauma because it's continual and it's over time and it's repeated. And really what we're looking at is regardless if it's overt or covert, there is a sense of my life is in danger. And that's the really important key there. Like this situation is so dangerous or so traumatic that I might not survive it. And trauma in general, we really loosely define that, but what here at the Meadows is anything that impacts you or anything that was less than nurturing. But what we find here, especially with our population, with women who struggle with PTSD, is that there's almost like a foundation that occurs at early development prior to even any overt trauma.
Okay, gotcha. Thank you for clearing that up a little bit. How often do you see eating disorders and PTSD occurring together? I hear sometimes from people, it's almost like everyone who has an eating disorder has some level of trauma in their past. Is this something that is becoming more common, or is it just that we're more aware of it now?
I'm not sure the answer to that question. I think there might be a little bit of both in there. That's true. That I think it is more common. I think that also there's more awareness because when you think of even like if we just take the Me Too movement, for example, that type of female sexual harassment or sexual assault, was happening years ago, but women didn't have a place to safely report that. And it was, customary for us to tolerate that. Whereas now, today, there's a whole a different standard that has been established and is continuing to be established. So I think we're also seeing it more. But yes, PTSD and trauma and eating disorders, there does seem to be a strong link regardless of what's occurring externally. And typically what we see with our patient population is that it starts off with early attachment disruption. And that early attachment disruption really threatens a child's sense of survival. And what happens is that as this child grows up, so we're really looking at more of like developmental trauma here, like with family of origin. If there's not healthy attachment from the onset, then we're more likely to see like emotional abuse, maybe even enmeshment, which sometimes can feel good, and physical abuse, sexual abuse. But typically what we know, and even according to the CDC, is that young girls are experiencing sexual assault and rape really early on, like as young as by age 10, 8 to 10 seems to be a prime age for sexual assault and or rape. And so what happens then, so you have disruption of trauma, you've got sexual assault, and there's usually already some unconscious eating disorder patterns that are being established that the patient or that people typically don't realize. And then what happens is that our population starts to medicate in some way. So it's also not uncommon for them to start abusing substances, which is also concurrent with the statistics on the CDC, is that by high school, we've got, even in middle school, we've got children who are addicts. And by high school, they've tried a range of substances. And so by the time we see them in treatment, they are an adult that typically has repeated sexual assault, repeated rapes. And sometimes these women come into treatment not even understanding that what they have experienced is actually sexual assault. And so we have to define that for them. But so oftentimes they come in with that PTSD. And as a result, what's the one thing they can control when their life is out of control? And that's food. And so that plays a real strong factor when they are feeling out of control internally. And so food becomes either something that's of comfort, where they might binge and purge, and or it could become something that where they have shame of their own existence, and the control comes in a form of, I refuse to eat, I want to restrict, which can also pop up in several ways.
Yeah. Wow. Oh, it really never gets easier to hear those very, very young ages where girls are experiencing sexual assault. It's really incredibly sad. And it just fills my heart with so much gratitude that there are people like you and places like the Meadows that are dealing with this and helping women to recover. Just want to say before I move on that I saw some new people log on. And so just want to say welcome to you, and feel free to pop in, say hello, tell us your name and where you're signing in from, and feel free to ask any questions at any time. But just want to say very, very glad to have you here. You talked about the kind of the intersection between underlying trauma and eating disorders. When people come in, we talked about this a little bit before in our conversation before this live, and that is the kind of gray area sometimes that eating disorder symptoms can present when someone comes in. And I'd love for you to talk a little bit about what that looks like, and also how that might affect someone's identity of, like, because we have such a strong image in our mind of what someone with an eating disorder looks like or acts like or behaves like, but there's really no one way that an eating disorder can manifest. What does that gray area look like? And can you give people some reassurance that even if they are in a gray area, any struggle is worth getting help?
Yes, absolutely. And so that's where Willow House, where we really come in, is in this gray area, because if you're familiar with the Meadows, we also have an eating disorder treatment facility, the Meadows Ranch. And oftentimes we'll get people who don't quite qualify for that diagnosis of an actual eating disorder. And it's obvious that these women are struggling. And so we can bring them into our program and work collaboratively with TMR on the Meadows Ranch on assessing how severe this gray area is. We also have a registered dietitian who comes to us from Eating Recovery Center. So the women can really find a safe space here. And what's great about that is that this is the largest group that doesn't have a lot of inpatient services available to them. So, because if they are not severe enough, they do not qualify for an eating disorder facility. So when they come into us in this gray area, and we see quite a range, we see people who are like right on that cusp, where if we don't help them gain some weight, if they lose even 2 pounds, then we might have to transfer them out, but they might be a pound away, or just like a little bit away from being inpatient, and we'll still bring them in and work with them on developing the meal plan and the healthy recovery that they need. And we also see all the way to the other end, where we can actually restrict and we can actually indulge or binge, but not necessarily experience physiological consequences. So regardless of where someone falls on that scale, what we really try to assess and look for is motivation. Like, what is going on here? What is the intent of these behaviors? What are we self-medicating from? What is it that, is there a toxic core belief system that we need to identify? And so oftentimes we'll implement a real unique assignment here, and it's eating disorder arousal template. And we have to be careful sometimes too when we use the word eating disorder, because if they don't technically qualify for one, we'll just flip it to disordered eating. And but that gray area is so important, because that's the part where if they can have some help, they can move away from that, instead of either staying stuck in the gray or moving towards more severity and symptoms to the point of an eating disorder admit. So, our goal is to really help them to understand all the underlying factors that are contributing to this. And because if you're using it to cope, if you're using it as a way to medicate, we want to know why and what do we need to do in order to medicate in healthy ways.
That's so good. First of all, Rebecca says hi. Hey, Rebecca, so great to see you here. Thank you for saying hello. And welcome anyone else who wants to pop in and say hello. Please do at any time. You mentioned toxic belief systems. What are some examples of a toxic belief system, or things that people might hear in their head? And I don't mean that in like voices we hear in our head. I mean, this is normal. We talk to ourselves all day long. So healthy people, not healthy people, we all are always filling our brain with some kind of belief system about ourselves. What are some examples of a toxic belief system?
So, for example, a toxic belief system might be like, I cannot gain weight. I cannot gain weight because if I do gain weight, then that means that I'm ugly, I'm unattractive, no one will want to be with me, which oftentimes are belief systems that they have picked up either covertly or overtly from their childhood. And oftentimes, if they're in abusive relationships, it could be that a abusive partner is telling them, making comments about their weight, and so their emotional stability starts to decline. Their ego strength starts to crumble, and so they start to believe that. And so they might believe like, oh, I'm not good enough, my partner is going to leave me. So this can really surface in such a variety of ways. And in the other way, it could be, I don't feel safe unless I'm overeating, or nobody wants me anyway, so I might as well just overeat, or I was abused so many times that that's all what my body is good for. So, I might as well either starve myself or overeat to the point where, I feel sick and tired. And so there's so many different toxic beliefs that might be in there that are connected, with food. And of course, that's where we really want to do some of that dissecting.
Yeah, absolutely. Thank you for that. Because I think people, if they're not used to listening to their thought life, that it can feel so normal what we think about ourselves, that it helps to hear an expert say like, no, if you're believing these things, they might be toxic and be having a negative effect.
Yeah, and if it's okay, if I just add, and there are some signs, right? Like if I'm counting calories, for example, and I purposely deprive myself of nutritious meals because I think I'm overweight, I want to lose weight. So that's another type of like disordered thinking that we want to, that it's actually, we want to work around and let our women know that it's okay to give yourself nutritious meals. And whether you love food or you eat just to stay alive for survival, you can do that in a healthy way.
Yeah, absolutely. So you talked about the motivation, the why people medicate in a certain way so that you can kind of help them out of that. And you talked about how important mindfulness is in that process. And so I'd love to kind of segue into that process. What is mindfulness exactly, and how do you use it in the treatment process?
So mindfulness is really important with our program, because what we realized with our women is that patients don't like, and I think people in general don't like to be told like, this is what, you can't eat that, you have to have so much of this, and we're going to check your plate, or you need someone to hold you accountable for all of that. And oftentimes that backfires, with our patient population, because what we're doing is the very thing that they feel like they have control over, we're completely taking it away before they have the skills to try something healthy. And so we always start with mindful eating, and we use a scale of 1 to 10, with where are you at hunger, with 1 would be starving and 10 would be like uncomfortably full, like painfully full. And so we oftentimes ask women to check in with their bodies and check in with their hunger. You know, we don't want them to approach meals where they're absolutely starving and they're at that 1, because we typically, if we're starving, we'll overeat. And so ideally, it's great to start at a 3, where I'm hungry, I need to eat, and but I'm not like starving. And then, of course, we want to teach our patients that eating to a 10, you know, ideally when you're painfully full isn't healthy either. And so we want around a 7. You know, we want people to feel satisfied, but not to the point where they can't move because they're so stuffed. And sometimes it can be hard figuring out that range. And of course, some people might fluctuate a number or 2. But the main goal there is for them to check out themselves, to check out their hunger cues, like pay attention to their stomach. What is their stomach telling them? And women who struggle with identifying hunger cues work with our dietitian to learn to sort of like re-trigger or pay attention more to those hunger cues and be more connected with the body. So they get, now sometimes our women will start at a 1 at starving, and or sometimes they might end at a 10, and that's okay. There's never any punishment. It's more about just understanding why. So what happened that I started my meal off at starving? Did I miss a snack I should have had? Did I wake up late and miss breakfast? And what was it that sort of led me to eat to the point where I was full, painfully full at a 10? So there's no shame in where they are at, or even if they've been doing really good work at 3 and 7, there's a shame-free approach, and it's just more, well, let's just, take a look at what was going on. And then they get to identify their emotions. So what's coming up? Did they just do a really hard piece of trauma work? And do they feel, you know, afraid, or are they feeling sadness? So we really try to identify those with them as well, so that they have an awareness of which emotions might also influence their eating patterns and influence some of those belief systems. And then we have them identify, you know, if they're feeling, based on their level of hunger and based on their emotions, you know, what's coming up for them. Are they wanting to restrict? Are they wanting to binge? Are they wanting to purge, isolate? Like, what's surfacing in the moment? And the goal is to eventually to teach them that they can sort of hold all of this in their system without taking it out on the food, and that there's, you know, other ways to healthy ways to incorporate managing their emotions, so that way they can still eat a good, well-balanced meal. And we also have them check in, you know, with a peer for support, or if they needed support, we encourage them to reach out to a staff or peer for support. And so that piece, because they do it together, they all sit together for their meals, that piece has been really beneficial.
Yeah, absolutely. It sounds amazing. Just want to say welcome to Sarah. Sarah popped in and said hello and said, my daughter has been in recovery for 2 years. So way to go, Sarah, as a mom, for supporting her and for being here and learning even more about all of this yourself, and welcome. We've just got a few more questions for Irene. So if you've got any questions yourself, now is the time to pop in and ask them or share your story. Was that the worksheet that you just went through by any chance?
Yes.
Okay.
Yeah.
So, and, you know, I wanted to ask, a question came up as you were going through the mindfulness process. It seems to me that for victims of trauma who've stuffed things down for so many years, that it might be even doubly hard to even identify what you're feeling or where you might be on a hunger and fullness scale. How
Yeah.
long does that process start to take to wake up to even be able to recognize what number on a scale you might be if you've so long just practiced stuffing down emotions rather than actually experiencing them?
Right. Well, every person, it varies. Luckily, at an inpatient setting, they're working on that every day.
Mm.
And they're also receiving somatic experiencing and EMDR and neurofeedback. So we're really able to help guide them through that, so that they have at least a good beginning with it before they discharge. On an outpatient basis, it could take a lot longer. Of course, we do it intensively in 45 days. For an outpatient provider, if they're seeing someone who specializes in eating disorders, they can give them, certain tricks or certain tips, I guess, to help them pay attention. And it might be like, drink not necessarily before a meal, but just practicing, like, drink a cup of water and then, so many ounces, and then drink a glass of water within time. But start with noticing, what does that cup of water feel like in your system?
Mm.
So what does drinking the full glass of water feel like in your system? And, how do you know? So we have them pay attention a little bit closer to like their gut, their stomach, like what does that feel like? So that they get that sense of fullness,
Mm.
and so that they'll know, oh, okay, so we'll work with them on like, well, that's probably too full. And, when they're practicing just a cup of water, oh, that feels okay.
Gotcha. Ah, that's so good. I love that. And you're also making me really thirsty. Um, no, it's so good. And I just want to reiterate and underline what you said, is that these things take practice and they take time, and you even practice them after you leave a residential program. If you have
Yeah.
the privilege of being someplace like the Meadows where you have all of those wonderful people around you every day helping you. It just takes practice and take time. So give yourself grace for
Yes.
sure. So for people like Sarah who are watching, or others who are viewing now or maybe later on our YouTube channel, if they're a parent or a loved one who is trying to support someone in the recovery process, especially if their loved one has experienced trauma, what encouragement would you give or tips would you give people trying to support their loved one?
So I love that question, and it comes up a lot. And so what I always suggest to family members or friends or partners is, do not fix. Do not go into fixing mode, and right away ask what's wrong. And if the person says nothing, don't ask what's wrong 5 more times, because sometimes we know people and we know that they might not recognize it as quickly as maybe we are. But instead go into, okay, if something is bothering you, I'm here to help you. And all you have to do is just let me know what I can do to support you. And that right there is enough. It's so powerful. Another thing, especially with adolescents, is, sometimes as parents, we're terrified, right? Or as family members, caregivers, we're terrified that a loved one, especially if they're young, has an eating disorder, or even if they're older and we see them, their lives are really starting to fall apart because of that. But regardless if they're in recovery and just having a tough day, or not in recovery, the best thing to do is just let them talk to you, and you listen, even though it might be really hard, especially for parents. Parents never want to lose a child. And so sometimes it's easy for us to be like, you didn't eat why are you hiding that egg for breakfast? I saw you hide that egg under that pancake, and you need to make sure to eat that. And I'm not going to leave the table until you do, because we're terrified, right? And yeah, and we do it out of concern, of course, but it's more, the best thing you can do in that moment is just say, hey, I noticed you hid your egg. What's coming up for you right now? and just listen without judgment. And how can I support you? It's really the most important thing. And then, of course, if they're seeing a therapist, encourage them to tell the therapist. And of course, if you're the parent of a minor, you get to report that to the therapist as well.
Yeah, such great advice. And last question is, if someone is watching this either now or later and they're really struggling in their recovery, or maybe they haven't gotten treatment and they're thinking, maybe I need to do this, what encouragement would you give them?
I would tell them that they deserve to have the help that they need. And whatever is going on inside of them, there are experts who are willing to stand by their side and guide them through their healing journey and healing process. And even though it's terrifying, beyond, this is my quote, this has been my mantra this year, and I share this with all of you, that beyond fear is freedom. And take care of yourself and reach out for help.
I love that. Beyond fear is freedom. Amen, sister. Preach. I love it. Irene, this has been really, really educational and very, very helpful. Thank you so much for sharing your wisdom and your time and helping illuminate so many things about this. I hope that for all of you that were watching, that this was helpful and encouraging for you. And just want to underline everything that Irene said, and also just don't give up. Do not give up. Keep fighting, because it's worth it, and full recovery is possible, and you can do this wherever you are in the journey. And no matter how many times you feel like you've fallen off, you can do it. And we believe in you. So with that, we are going to say adios, ciao, tschüss, au revoir. Elsa says, ciao. And Elsa believes in you. Everyone needs a little dog who believes in them. But wishing you a very, very wonderful evening, day, morning, wherever you might be in the world. And we will see you back next week for another episode of Weekly Hope. Stay tuned to our social media channel so you can find out time and our guest and topic. But we're so, so glad to have you here. And of course, please share this resource with anyone who you feel might need it. It will be posted in a few days on our Eating Disorder Hope YouTube channel, where all of our Weekly Hope episodes are. You can find any one of them. But we're here for you, and we just want these resources to be shared so that people can get the help that they need. So thank you so much for watching, and we will see you all next week. Bye.